on the door, enter. I'm gonna do hand hygiene, and she's clear over there. Hi, Sydney. How are you doing today? We would have done like a nurse, what's it, where you like switch, you know, your old nurse introduces the new nurse. But my name's Lacey. I'm gonna be your nurse today. Can I get your name and date of birth, and I'll check your ID band? Okay, great. Sydney, birthday. So I needed, first I'm gonna excuse visitors and give her privacy, and I already shut the door also. The visitors will shut their door on the way out. So vitals, so I'm gonna start with your heart rate. A normal heart rate is between 60 and 100, and we'll get your blood pressure. A normal blood pressure is 120/80. We'll do the pulse ox. It should probably be above 95%. And then respirations. Normal respirations are between 12 and 20. Let's see. Oh, and temperature. We don't have any. Okay, temperature is between 36.5 and 37.5. And then I would listen to heart and lungs. Actually, I'm gonna get your pain score first. So on a scale of 1 to 10, what's your pain? A 4. And what is it like? So the characteristics, is it burning, pressure, burning, okay. When did it start to hurt? Where is it located? Vagina. And it started to hurt when? When the baby came out, when it was trying to come out. So D, duration, it's been hurting since the baby came out. Exacerbation, is there anything that makes it worse? If you move, okay. Any related symptoms? Does it radiate anywhere? So your vagina hurts, does it hurt? Like, does it make it hurt anywhere else? No. Okay, and how about like your abdomen? Is there pain there? Not really, not right now, but there will be in a second. Anything that makes it work? We talked about that. Okay, I'm gonna listen to your heart and lungs. It's very quiet. Okay, and I'm gonna check your breasts, make sure they're tender, not tender, what's the word? Just not engorged. And then check the nipples for, that's really tight. Check the nipples to make sure they're not too tender. And then how's the baby been latching on? So the latch, so we would do a latch score of, you go over there. A latch score. So next time you feed her, let me know and I'll come and check and make sure she's latching on right. Because if she's not, it could cause a lot of problems, and it would cause a lot of pain too. So the latch score is for latch. The A is for audible swallowing. T is for the type of nipple. C is for comfort, and H is for how you hold her. So, and I can teach you like different ways to hold her. Like you could hold her with this hand and then like move her head and hold your breast like that. Or you could hold her like a football and move, like hold her head, hold your breast like that. Or those two are the easiest ways for brand new moms, I think. And then after you guys figure out how to work together like that, you can breastfeed laying down or walking around or whatever you want. Okay, so I'm gonna check your abdomen, is that all right? So I listened to her heart and lungs. I did the breast. Okay, so abdomen. I'm gonna lift this up. So I'm gonna listen for bowel sounds in all 4 quadrants. She has active bowel sounds. Have you passed gas and been able to have a bowel movement? Not yet. Okay. So make sure you're taking the stool softener. That will help. And if you get up and walking, that will help your bowels move, and then you can you'll be able to poop easier. And the bladder, have you been able to urinate yet? Yes. Okay, make sure you're urinating every 2 hours, even if you don't feel like it. Just try it, because sometimes our organs kind of get jumbled up when we're pregnant, and then you might lose some sensation, but it's really important to empty your bladder so that it doesn't get in the way of your uterus. So I'm gonna, is there any pain or burning when you urinate? No. Okay, that's great. And make sure you're using that squirt bottle. So after you pee, squirt it and rinse everything off, and then you can pat it dry and wipe like always from front to back, but just pat it from front to back. And do you have any questions? Okay, I'll talk about the pad situation in a minute. So I'm gonna put my fingers above the pubic symphysis and then feel the uterus for bogginess, and it's right about at the umbilicus, and it's firm and it's in the center, so the location is good. And then also I'm gonna check your pad. There's lochia that's scant, and it's red, and it doesn't smell, and there's not pooling of blood or clots, and I would feel for it, make sure there's no clots in there. Check the perineum for hematomas and reta, so redness, ecchymosis, edema, discharge, and approximation. You don't have any tears, so that's great. What else? I can't think of anything else right now. Okay, and then if she needed her pad changed, I would change it, and or if she could do it herself, I would just teach her how to do it herself. Okay, then I'm gonna check her legs for thrombophlebitis and edema, and make sure she can move, maybe check her reflexes, and then check for the clonus. That's good. Check for mobility or range of motion. She said she could get up and go to the bathroom, so that's a good sign. Okay, and then maybe check cap refill one down here. Okay, okay, do you, how are you bonding with your baby? You like her? And I probably would just like observe more than anything, like, I mean, I could ask too, but observe and just watch if she likes to hold her baby, and if she is making eye contact and holding her close, and, okay, and then how are you feeling about all of this? I know it's a huge adjustment. It's overwhelming. Okay, but overall she's happy about it and feeling good. If you start to feel sad, or if you feel like you want to hurt your baby, just put her down and then walk out of the room. That's really a normal thing. Like, I feel like most moms go through this. And do you have somebody, like a support? Do you have, how's your support? Her husband's really supportive, and Just make sure you're resting as much as you can. Sleep when the baby sleeps. You've probably heard that, but it's really important. And do you have any like religious or cultural practices you want us to incorporate into your care? No? Okay, we're gonna do this padsicle. So this is ice. So I would get like the underwear. It has a thing. I don't know, that's cool. Okay, so put this in your underwear, this ice, and then put the pad on top. Because you don't want to put ice directly on your skin because that could cause damage. I know it feels good, but you're not supposed to do that. So ice, pad, and you know how to use this. Also, it can squirt the ceiling. And then use, these are Tux pads. So you can layer them in there. And then you can put this either on here or directly on your vagina. You could spray this on here directly on your vagina. Whatever feels the best to you. And then make sure you're changing your pad at least every 4 hours, or just whenever it gets saturated, just make sure you're changing it. Okay, if you had a vaginal birth, this stuff. If she had a C-section, I would educate her about the turn, cough, deep breathing, and like splinting the incision when she moved around, or probably when she coughed too. Like when she gets up to splint it, and educate her about signs of infection, redness, swelling, like warmth. Oh, and I would check the bandage for drainage and make sure it's clean and dry and it's intact. And the newborn needs to sleep on her back and burp her after every feed, at least 1 to 2 minutes. And don't submerge her, like don't give her a bath like submerged until her umbilical cord falls off. So 3 indications for a C-section are fetal distress, a breech presentation, and placental abruption. And I know there's more, hold on. If the patient had a C-section, I would also check the patency of the IV, check the patency of the catheter, and check the color and stuff of the urine. And if she had Duromorph in her, is that what it's called? Okay. Duromorph in her epidural, teach her to ask for help when she gets up the first time, especially, and then if she has any breakthrough pain, to let me know, and I can see if I can order some more meds. And if she had a spinal block and she has a headache, to lay flat. And I still feel like I'm forgetting something, but I can't remember. So I would leave her. I would make sure she had a call light and her water was next to her. And if she needed help getting up, I could help get up and like teach her how to use the squirt bottle or whatever. Okay, if you have any questions or you need anything, do you have any questions right now? No? Okay, great. If you need anything, let me know. Thanks. Okay, so I'm going out. I'm going to take off my gloves, do hand hygiene on my way out, and shut the door. And that's all. Thanks.